And joining us from Los Angeles is Dr. Matt Hendrickson. He's with the group Physicians for a National Health Program, which actually wanted a single-payer, non-profit health system, but this health overhaul signed into law keeps for-profit insurance companies as the base for America's medicine. So does that mean then there is still much to do, in your opinion, or is this a good start?
I think the jury is out. There are two camps on whether this reform will help our chances or hurt. Most feel that in the short term it will hurt our chances because what it's doing is transferring $500 billion to the private insurance industry. So it will enrich and entrench the private insurance industry in what is the fundamental flaw of the American healthcare system, that it is a for-profit, private insurance-based model that can't cover all Americans and can't control cost.
So that's a disaster then, isn't it?
Well, in the short term, as a physician, it's hard for me not to appreciate any attempt being made to increase coverage. And currently we have about 50 million Americans that have no insurance. 50,000 of those will die every year because of lack of insurance. So it's hard for me to oppose any attempt to increase Medicaid, to give subsidies to people, to purchase insurance. Unfortunately, in the long term, the chances for true reform might be harmed by the fact that the private insurance industry becomes wealthier and stronger.
Under this measure, though, how many people will remain uninsured?
The estimates are around 23 million will remain uninsured, although that number will probably grow because, as we've seen in the Massachusetts model and in several other state models, the initial attempt to subsidize those that can't afford the insurance slowly diminishes because the costs are not controlled and the government can no longer keep up with the rising costs.
What about the issue of those going bankrupt because of the medical expenses that they have to incur?
Yeah, rather shockingly, 2 out of every 3 bankruptcies in this country is medically related. That will probably not change at all because the reason folks are going bankrupt is they lose their job when they get sick, they don't get a contribution from their employer, and they can't continue to pay their premiums. Hence, they lose their savings.
What about the issue of pre-existing conditions, at least? Is that now watertight? Insurance industries can't refuse to treat people because of so-called pre-existing conditions?
Yeah, that is a nominal improvement, although the private insurance industry helped to craft this bill and has already placed certain areas of wiggle room, such as being able to charge those that are older up to 3 times more than those that are younger, charge those that are female more than they do males. So the private insurance industry is a master at overcoming these regulations, and they helped to create this bill.
I know you were trying hard to say that, look, this is good in the short term, but it does sound disastrous. And I mean, what went so wrong there when President Obama said, look, we can't go for a single payer system, let alone a public option, as your group was advancing? I mean, was he right that it was impossible?
I personally think he was. You know, there are many within my organization that would say he should have taken a more ambitious position. Personally, I think that this was probably as much as he could achieve at this moment. But there are states such as California and Pennsylvania which are hopefully going to be moving to a single-payer system in the next 5 to 10 years. That will probably be the domino that is necessary to move the entire country to single payer. Ultimately, most people believe there is no other solution in the long term to controlling costs and covering all Americans.
Dr. Matt Hendrickson, thank you very much.
Thank you.